TiM on MyPathway is an application on ADI's MyPathway digital health communications platform. TiM stands for Telehealth in Motor Neuron Disease, and it's a specialist application to support patients with motor neuron disease and their carers and connect them into specialist motor neuron disease centres. ADI has been providing digital platforms and pathways for the NHS since 2012. We're pleased and proud to be working with the great team in the Sheffield Motor Neuron Disease Centre, and we're delighted to be able to help them make a difference and to be a trusted technology partner for SITraNs. With the advent of COVID-19, there was an urgency came in to the work that we did with Sheffield. The driver then became, what can we do now to support people remotely and avoid the need for them to come in actually into the clinic.
We worked with ADI to develop a new online tool or app for our patients living with motor neuron disease. The main driver for developing the app was that we could provide better care for our patients. The journey into the clinic or the hospital can be very arduous, time-consuming, and cause a great deal of fatigue. A traditional clinic visit would involve 5, 10, 15 minutes talking to the patient to find out what's been going on. The beauty of the TiM system means we already have that information before the patient comes to the clinic. The patient and their carer have been completing the online tool that captures everything that's been happening in their lives. That means when we're there, either in a virtual clinic or in a face-to-face clinic, we can focus on finding solutions to the problems and devote all the time to that. Hello, Mrs. Holsworth.
Hello.
How are you today?
Well, I'm feeling a bit down, to be fair.
I've been a specialist nurse working with motor neuron disease patients for a number of years, and the telehealth in motor neuron disease development has been extremely helpful, and I think it has improved our patient communication greatly. Patients are invited and they're able to self-register on any mobile device or a web portal. They're sent weekly or fortnightly questionnaires, and then they complete them. And that's allowing us to detect problems earlier than we normally would, as we normally have to wait, and help the patient in a more timely manner. Carers too can use the app and it gives them a voice. The online dialogue allows for easy expression of moods, especially where verbal communication is really difficult and they have problems. They're given their voice back to be able to express their feelings and their anxieties, their difficulties with their illness.
Feedback from the TiM development has been really positive, both from patients and from staff, and also from the carers that have been using the system. When we were developing the TiM system, I went out to talk to people living with motor neuron disease and their family, and they said how important it was to have the right information available for them. So the TiM can share that information quickly with patients, and we often point them in the direction of the charity, the Motor Neuron Disease Association, so they know they're getting really reliable information, and they can also reach out to the charity if they need to for extra support.
In Sheffield, we're really pleased with how the TiM on MyPathway system has developed. Originally funded by MND Scotland, a Scottish-based charity for motor neuron disease. It was originally planned for just Sheffield and Edinburgh, and now it has expanded to include places like Dublin and Norfolk as well. We find it really important to offer bespoke services for each of those centres. We're able to give information to people with MND through the TiM on MyPathway system, but what that information is entirely up to each centre. If you want to get involved, it's just a case of getting in contact with either myself or ADI, and we work with you through the entire process, getting contracts in place, working with you to understand what specific package of the service you need.
In January 2021, there was a session at the World Economic Forum in Davos which said that digital health's moment is now. Digital health has gone from a technology with lots of future promise to rapidly becoming the preferred and default mode for healthcare services to interact with patients and carers. We currently facilitate the care on MyPathway of around 60,000 patients. We expect that to increase dramatically over the coming months under the pressures of COVID long waiting lists and the specialist needs of people such as the patients with motor neuron disease that we are supporting through Sheffield. If you're a clinician looking to better support your patients with a remote digital package, please get in touch. MyPathway has been designed to be rapidly configurable and deployable, that we can tailor it to the needs of a particular patient group, a particular clinic, and deploy it in a few weeks. The package includes all training and support materials, and can be tailored to you and supported, enabling you to transform the care that you deliver to your patients.